everyone. Before we actually begin the presentation, I just want to go over a few things. If you have a question for us, if you look, the chat box will be to the right of your screen, and it should be sent to all participants so that we can see if you have any questions. And check your audio now at this point. This is our program for today, and as I said earlier, I'm Michelle Berta, the Education and Health Literacy Coordinator for NNLMR. Our session today is we have closed captioning. There's a link provided in the chat box. The session is being recorded, and several weeks after the session, it will be put on the NNLM YouTube channel. As I said, you can put your questions in the chat box as we go along, and Julie has agreed that at certain points during the presentation we'll stop if there are questions and she'll answer them at that time. You can get 1 MLA-CE for attending today. At the end of the presentation, there'll be an evaluation that'll pop up. And once you answer that evaluation, you'll receive an MLA-CE code that you'll use to get your credit. And we also ask that even if you're not interested in the MLA-CE credits, that if you could still answer the evaluation. Thank you. So our guest speaker for the presentation today is Julie McKinney. She's a health literacy specialist and the director of product content at Exceptional Lives. Exceptional Lives is a not-for-profit organization which provides easy-to-read information for parents and caregivers of children and adults with developmental disabilities. So I'm going to turn this over now to Julie.
Thank you so much, Michelle, and thank you so much for inviting me to talk about Exceptional Lives on this webinar. I just want to say I also am the moderator of the Health Literacy Discussion List, which some of you may be on. So love to have you on that list as well. But right now I'm going to be talking about Exceptional Lives. And what it is, it's I'll go over it, but it's a way to get information to families and caregivers of children and young adults with developmental disabilities. You know, I know that probably all of you here, you know, are in some way involved in getting information to the public about different things, and I know that NNLM has been very involved in health literacy and making sure information is easy for people to understand and navigate, and that's what we have tried to bring to Exceptional Lives. I found that there's a lot of health literate, easy to read, plain language information about a lot of topics like nutrition and diabetes, but when I started this work with Exceptional Lives, we found that there wasn't very much easy to understand information about disabilities and how to find services and supports. So we wanted to get that into the hands of the families that need it. So what this helps people with is not about treatment and you know, medical details, but what it does is helps families connect to the services and supports and benefits that they need in order to care for their children. As Michelle said, yeah, if you have any questions, please put them in the chat box, and I've let Michelle know that you know, if it's something that relates specifically and it would be better to get answered right away, I'm happy for Michelle to break in and say, oh, we have a quick question about that, so that's totally fine. And then I will stop and you know, sort of have a moment to catch up on whatever questions there are. Let's see. So the problem that we're trying to solve here is that you know, when you have a child with a disability, it's really hard to know what to do. Most of us at Exceptional Lives have children with disabilities, and we have been through a lot of these processes, and we have been through this sort of emotional and logistical journey. And so we know that it's an emotional ride, and that people who are looking for information are often sleep deprived, stressed, emotional, and so I think even more than at other times, they need the information to be really easy to find, easy to understand, and they need to sort through lots of information and lots of complicated processes. So that's what we're trying to ease here. So when you do get to, mostly what people do is they Google the information they need. So say your child has autism, or you think they might, you search for it. You get tons of results, and it's just very overwhelming. How do you sift through it? How do you know which sites to trust? And it's just very difficult. So and then once you do choose a site online to get your information, they often look like this, which I've gotten to things like this several times, and you just put it off. Okay, it's too much mental effort at the moment to get through that. So we know that there's too much out there to sift through. We know that taking the time it takes to interpret which is the right information and then understand what it's saying, it increases anxiety, and then overall people are less likely to actually get the health services and the social supports and the governmental benefits that their children qualify for, because it's just too much. They don't know what services are available, and they do note that children in low-income families with less educated parents are less likely to find these services. So clearly it's a health literacy. I'm sorry for these. Okay, that's just on my screen. It's clearly a health literacy issue too. People who struggle more with understanding health information and complicated processes are going to be less likely to get the services that are going to help their children. So it becomes a health equity issue as well, because low-income families, minorities, people with health literacy challenges are going to be more challenged in getting these services. We know that about a fifth of the people in the U.S. have a disability of some kind, and low-income families are more likely to have a child with a disability. And so to make sure that this information gets out to everybody and can be understood by everybody is, in our minds, a way to address health equity. We also know that caring for a disabled family member is a strain on finances, so people who have children with disabilities, often both parents can't work, so often they have financial stress as well. So we're trying to make this easier for everybody to connect to the benefits and services in all of these four quadrants. So they need to connect to the right medical care, diagnostic services, their government benefits that can help their family and their children dramatically. The education system is a big point of confusion and frustration when you have a child with a disability and you have to go through the special education process. But at the same time, of course, if you can go through that process, it makes a huge difference in your child's learning and potential and quality of life. And then, of course, people need social support. So, so we're trying to offer all these things so a parent can come to our site and connect with all of these types of services they need easily. We always like to just make sure that we realize that the information that we're sharing and the benefits we're connecting people to is really making a big difference in the lives of real families. People have a baby and they have every hope of all of the opportunities being available to that child, and when they have a disability, they realize it's going to become a harder road. So this is a picture of the bottom left is of early intervention, which is a service for kids from 0 to 3, which helps teams them up with therapists that come to their home, occupational speech therapists, vision therapists, and can work with the family and the child at home to support their development. You know, personally, this is my son. I was lucky enough to get these services right at the beginning when he was a couple months old, and it made a huge difference. You know, a lot of, and that's what we're trying to do, is to get people connected with these services as early as possible, because the earlier they get connected with them and get started on these therapies, the better chance their child has to make the most of their development. Over on the right, that's an occupational therapy session, another one of our workers at Exceptional Lives. So like I said, you know, we've been there and we know how important it is to get these services as quickly as possible. So this is our site, and I'm going to show you the site live in a few minutes. But I just wanted to sort of go over what we have on it. It says select the state here. So just saying right up front, we've developed all of these resources I'm going to tell you about for 2 states so far, Massachusetts and Louisiana. We have some resources that can be used by any state, and I'll show you those too. But we find that it's helpful to be specific to the state, because then we can go through the way the process is done in that state. For example, early intervention, which I was just talking about, it's called Early Steps in Louisiana. It's the same program, but it has a different name and different places that you call to get your child set up. There are a few other parts that are different. So we find that it's really helpful to describe the information in a state-specific way so that we can be more specific and really lead people to the right forms, the right places to call, and describe the process in the way it's done in that state. So the main things we offer are easy-to-read how-to guides, which go step-by-step to explain how to navigate each of these processes. It's plain language, we use health literacy principles in everything we do, and we try to make it very action-oriented. We're really trying to help people take action to connect to these services, to sign up, to see if they qualify, to start to set up their care plans, depending on what the service is. We also, in the 2 states, have a searchable resource directory where you can search by zip code for 50 different types of services that you might need to help a child or a young adult with a disability. And I'll show you that. And then, you know, we know we're a website, and we know that face-to-face personal attention is always better and easier, but we're trying to extend the reach of helping families through these processes. So a website in this case can reach more people. Oops. But we do have ways for people to talk to us. You can call, chat, email, text, and we can sort of walk people through. And we do get a lot of calls from other states, and in that case we can direct them to specific places where they can call or go to get information in their state. So, you know, I'm putting a health literacy spin on this, and, you know, we know that to be health literate, we need to help people find the information, understand it, evaluate it, communicate about it, and to use it to live healthier lives. And so what we're trying to do is to get at that last one, that action step, which is often the hardest to help people through. So we're trying to have people go through our information and actually come out with services and benefits for their family that are going to help them. So let me just go through the easy to read how-to guides, just sort of basically what they're like. They're plain language, they're step-by-step. You can use them on computers, iPads, tablets rather, and smartphones. We can print out, certain pages, like if you're going through this with a family, you can print out page by page the things that are relevant to them, and I'll show you when we get to the resource directory, you can print out those lists as well. These are the topics we have. It's slightly different in the two states, but these are basically the kinds of things we have. So if your child is different, maybe not developing, typically, we sort of give you the basics, how to find out what it is, what systems to connect with. If your child has autism or you think they might, we go through that. We go through the early intervention process, how to apply and how to set up the plan if you qualify. We have information about health insurance, how to find the disability benefits if you have insurance, how to get insurance if you don't have it, and how you can get Medicare for a child with a disability even if you have primary insurance. We do SSI benefits. That's a big one. That's supplemental security income, which is for low income and people with low income or disabilities. And that's something that you can access from any state. It's the same process from any state, and it's a very complicated process. I just went through it myself for my son, and it's very long and frustrating. So our guide sort of helps walk you through that, and it gives you some sort of worksheets to help you figure out if you're likely to qualify, and then you can download the forms right there to help you apply for these benefits. And then we have special education. That's one of the biggest questions people have. How do I apply for special education? How do I, manage my IEP meeting for my child? There's a lot of things of support people need around that. And then transitioning to adulthood when your child is in their teens and either graduating from high school or turning 22 and having to find adult services. That's a very tricky time. And then for adults, with disabilities, employment, and then guardianship and decision making. So if you have a child who needs you need to get guardianship to make their decisions once they turn 18, again, that's a tricky process, and people need some guidance through that. So these are sort of the basic topics that we cover. So I'm going to go through just a little bit about our process, and that's something I know that you guys are not. Probably most of you are not from Massachusetts or Louisiana, so I'm hoping that you'll get out of this sort of a concept of what we've done at least to make this resource easy to use, understandable, and fitting people's needs. So that can sort of be a model for other sort of information platforms or materials that people are creating. So when we develop a guide, for example, we get input at all phases. So we have focus groups and interviews with parents, of course, with parent support professionals. So in every state there are parent support organizations throughout the state that are specifically there to help guide families of kids with disabilities through these processes. And they can meet them in person, and they have workshops and things like that. And so we've talked to people who do this in the states we work in, and they can give us a sense of, we talk to dozens of parents every week, and these are their sticking spots. This is where they need help. This is where they need to really push with advocacy. So we can get a sense of that. We talk with parents about, what do they need to know? What do they wish they knew when they started this process? And then we talk with state officials, so people in the Department of Education or people in the Medicaid office who can make sure that we have accurate information for the process that we're going through. So we assess needs and we help to, make sure that we're choosing the right topics and details that are going to help families. We test drafts and we go back to the focus groups and people and have them evaluate them. And we update our guides all the time. So sometimes there are new rules that govern a certain process in a state, and so we can go in and update that right away. So we get input from the people, from our audience. And then, we make it easier using some tech solutions and also just basic health literacy principles. So everything is designed to be health literate and written in plain language. We have small chunks at a time, and we have an option to sort of like click on a box and get more information if you want. So we have sort of the bare bones on each page of each topic, and then if you want more, then you can click on more. We have terminology, so if there's a word that's new or unfamiliar or an acronym, we'll define it the first couple times, but after that you can hover the mouse over it and get a definition just to remind you. Like I said, we test it with our audience, and we also have downloadable forms. So sometimes if there's a fact sheet that we know is high quality and easy to read, we'll throw that in. People can download it right away. Also, like I said, the forms, like if you're applying for guardianship or SSI benefits or special education, we can have you download the forms right there on the site, so you don't have to then go to their site and find the form and download it. So we're trying to sort of do all the legwork to put everything in one place and just have people easily go through these processes. Yeah, like I said, we know we're a website, so we're trying to make sure that we have some personal attention. We want people to know that that we understand they're not alone. We're trying to address some of the emotional journey that people are going through. We're trying to help people to understand their rights and to know when they need to sort of speak up and push for what they qualify for. So those are the guides. That's what we call them. And then the next thing is the resource directory, where you can search by zip code for different types of services. And I will show you that when we go to the live site. And that in both states has been translated into Spanish. We're trying to get funding to translate the other stuff into Spanish, especially the most commonly used guides, because we know that that's a big need. But we want to do it. We want to do it right. We have to get good translators and check it and everything. So that's been taking a while. But we have the resource directories available in Spanish. So okay, so that is. I'm just going to switch over now to show you the site live. So I'm going to share my screen. And if there's, that now would be a good time, if there's any questions, to, put them in the chat box. Also, I'd be curious to hear from people what kind of questions you guys get most often from your community and clients and the families that you work with in whatever capacity. Along the lines of what we've been talking about related to disabilities, what are the biggest questions you get or issues that people are having trouble with? If anyone wants to just sort of share that, I'd love to see it. So hang on a second. I'm just going to share my screen.
Okay, Julie, there is one question in the chat box. A person who's a librarian wants to know if are you able or are they able to share the guides, to print the guides and share with their patrons or consumers?
Yes, and we're working on making that a little bit better. So as it is now, you can, and I'll show you how this works, but you can print out any page of a guide, and it just prints out. We're trying to figure out a way to sort of put each one into a PDF so you can print out the whole thing in a format that looks nice and doesn't have all the cut off page ends and stuff. So we are working on that, but right now you can print out anything that's on there, but it'll just be sort of a page by page thing.
And just one other question early on was about sharing your slides. And I said that is up to you as the presenter. And if you want to do that or do it with people individually, that's up to you. So
okay,
that's another
great.
question. Okay.
Yeah, no, I'm happy to share the slides. I'm happy to talk to you or email with you afterwards. If you want, if you want to be on our email list, we send out, a newsletter every couple weeks, very short, with just 2 very short blogs that relate to some of the content that we have. So if you want to be on the email list, please just email me about that. So like I said, we work in 2 states, and then we have the national SSI benefits for everyone. So I'm going to show you that guide because that's something that relates to all states, and I can show you how that works. So you come to this landing page, and then you just click on Read the Guide. So this is the format of our guides. This is sort of how they look. And we always have an introduction. We always have a page with quick tips to find what you need. This tells you how to work with the menu, remind you to scroll down, definitions. It sort of shows you how our different features work, because we just want to support people who are new to web navigation. We just want to make sure this is as easy as possible. So then the over on the left side here is the table of contents. So there's different sections. Here are the basics, and then who qualifies. It's different depending on your child's age. So part of what we're trying to do here is with the menu is make sure that people know if they have a question that they want a specific question, they can find it easily. If you want to talk about applying, then you can go there. If you want to know what SSI is, you can go to this section. So, or you can just go page by page in order and find that. So, because it all goes together as a coherent guide if you just go page to page. But here we have, the basics of what SSI is. Like I said, we want to have not too much information on each page, but if you want more on a topic, you can just open this box and you get a little bit more information. So we're trying to make it flexible for people who want just a little bit or more information. And then we talk about who qualifies. We try to make it really simple. We try to use graphics and charts as much as we can. And then there are some other features we have. So for example, the application process, we go through it, and then that's sort of an overview. And then here we have the specific process. And depending on the age of your child, you can download the forms. So for example, if you're doing it for a child under 17, we can link directly to just the piece of the SSI site that has easy to read checklists and things like that. And then you can also download the kit and the report, and this is the form that you need to fill out. So we're just trying to make everything right here and have the forms easy to find. We also have, for example, in the qualifying section, a lot of times people want to know, well, is it worth going through this process? Am I going to qualify or not? So, it's very complicated. So one of the things we do is we have, this is the family income. We explain how they do it. And then we have an example here, and then you can also download a worksheet where you can put in your own numbers, and it will sort of add them up and give you an estimate of what your countable income is, so that when you know if you're likely to qualify or not. So that's sort of how these work. This is something, like I said, this the SSI guide is something that people from any state can use, but this is also sort of how our other guides are set up. So, for example, these are the Louisiana guides we have, and you can choose one. We have a new one here, actually, what if your child is struggling in school? And they have some, the data sort of go through all of these different topics. So this is what you can look at, if your child is having trouble, but you don't know if they have a disability or a learning disability. So these are basically how these work, and you can switch back and forth, and then you can, the breadcrumbs are up here, so you can follow your way back. And then, any questions now before, and then I'm going to show you the resource directory. All right. I see one. Do you monitor the frequency and use of resources based on the outcome? Resources. Okay, I'm not sure what you need for that. Well, I'll hold off on that for a minute and address some of these at the in a little bit. I do see
Julian, there's some comments you had asked about the questions that they get.
Oh yeah, good.
Do you want me to read those to you?
Yeah, that would be great.
Okay. So Jason said mostly on how to get SSI benefits,
Mm-hmm.
as well as information in Spanish. Let me see. And Carol said when families are vulnerable, they are sometimes afraid to even use resources that would involve using them to speak on their own behalf or child's behalf. She says, does advocacy in this sense ever include a representative? A lot of info can also be overwhelming. Librarians usually are a point of contact to share resources. Hope the question is clear.
Okay. Yeah. So yeah, and that's a really good point, because we know that I mean, families of kids with special needs are vulnerable in many ways anyway, and then when they're vulnerable in society as well, it's even harder. And I know that especially there's a lot of fear now around immigration and disclosing if you're not a citizen, and so that's something that we would like to address in its own guide at some point, and we do try throughout the guides to have sections on, what your rights are, and, when you are entitled to things, even if you're not a citizen. But that is a big question that we would like to address more. And as far as librarians, yeah, we work with librarians a lot, especially in Louisiana. We've actually done lots of trainings for all of the directors of the regional libraries around the state, and we've sent them all, we've sent thousands of bookmarks to the libraries there that has our website and sort of the basics of what we have, so they can hand the bookmarks out. Because yeah, libraries are a really good place, and we know that people do go there to both use computer and to ask for information about this. So we are, in our outreach work, we're trying to connect with as many librarians as possible. So yeah, no, you all are a very key resource for families. So we're trying to get the librarians in all of the places we are to know about us and be able to recommend us. So I'm going to show you the resource directory and how this works. So you can put in your zip code and then a mile radius. And like I said, this is in Spanish too. There's two ways you can do this. You can just go straight from here to just the list of resources, or you can sort of personalize it a little bit. So if you want resources, say for a child of a certain age, maybe with a certain diagnosis, but you don't have to. We only list these few diagnoses here because there are some resources that are specific to these. So for example, if you're looking for a family support group, but you want one that really has people with kids with autism, then you can click on that to narrow it down. So I'm going to say no, you don't have to say any of these. Do you need a provider who takes mass health? This is key if you're looking for a dentist that can work with a kid with special needs, or a diagnostic evaluator. If it's any kind of medical service that may be able to take mass health, then this will dramatically narrow it down. I'm going to say no for now because we might look for a service that like a support group that wouldn't anyway. And then you can also see if you need a provider who speaks Spanish. So these are the kinds of services that we can find. So all of these different therapies, you can look for education supports, consultants, tutoring, transition services, things like that. Parent and caregiver support is an important one, especially information referral, support groups, respite care. Those are key, and respite care especially very hard to find. And then social recreational activities, and again, these are specifically for kids with developmental disabilities of some kind. So we're not going to list all of the after-school programs in the state, but we're going to list the ones that are specifically, inclusive for people with disabilities. And then adult programs, residential programs, day hab, things like that, medical and evaluation services, diagnostic evaluations and developmental evaluations are a big piece that people are looking for, and those are the things that you can narrow it down by just the ones that accept Medicaid, which is really helpful. And then there's legal support, and someone was talking about advocacy and representative if people are vulnerable. So we do list some sort of free legal help for people who are maybe concerned about that and need an advocate of some kind. That's a place you could go. And then there's a few other things. So just let me show you how this works. So say, for example, I want to look for ABA therapy, which is the most popular therapy for kids with autism. So here I have the listing. This is around the Boston area, which is where I am now, and it lists all the places. But say now I do want to change it and say actually I need one that accepts Mass Health. So then I apply that, and it narrowed it down from 50-something to 27. So that makes it much easier for me to go through and find one that accepts Mass Health. If I click on a place, it'll have a short description. I can get the directions. It has the website, the phone number, and this you can print out. So for example, if you're working with a family, at a library, say, you can do a search like this with them, and then you can print it out for them. You can also print out the list so they can take that home and do their phone calls from home. So one thing about this resource directory that I want to make sure to say is that we update it every 3 months. We go through the most commonly searched for resources and go through every one of them and check to make sure that they still do what we say they do and the contact information is the same. We also have embedded in the software, it can do every week, it does an automatic check of all of the links. And so it'll spit out dead links of all of, like in Massachusetts, say we have 1,500 resources listed in here, and it'll spit out maybe 6 on a Monday morning, and we can call all those places and say, oh, why is your website not working? And it's like, oh, we changed our website, or maybe we're out of business. But that's another way we can just sort of keep up on things regularly. And I think having this updated regularly is something that is the biggest complaint that we hear about other resource directories. You know, there's tons of resource directories out there, but that's what makes this one a little bit easier to keep accurate. We also, you know, have a place where if there's if you have a suggestion, if you're on here, it's like, oh, I know a place that's in this area that's not listed, then you can submit it here. And we try to keep adding things as they come up. So let's see. We also have a series of blogs, and this is something that that is useful for people from any state as well. So, you know, based on what we find are our needs and sort of questions that parents have, we have these blogs we send out. We add like 2 every 2 weeks, but you can look through the whole list here, and a lot of these have they're all written by a parent who has kids with special needs, and they're all about they're about the state of mind, but also some of the practical tips and tricks that people need. But how to be with your kid out in the world is one of the big ones. This is one of our most popular, how to help families with kids with disabilities at holiday gatherings. That always gets a lot of interest. And you can search through our whole listing of blogs. So that's another thing that we offer. And we also have Facebook groups and that kind of thing. One of the things we find that parents really are looking for is to connect with other parents. So that's another thing in our guides. In every guide we have we have a section on how to connect with support programs and other parents. So we'll tell you how to get to the family support centers in your state. We'll show you how to find Facebook groups online, and then, of course, you can use our resource directory to find specific ones in your area. So, so that is the site. And maybe I can see, Michelle, if there's any other questions while I'm going back to the
Sure. I'll start with a couple. One of the things people want to know is, do you intend to expand this to other states, all 50 states? And the other question is how did you decide, or how do you decide on a state that you've chosen to work with or have information on?
Sorry, can you hear me now?
Okay.
Okay, sorry about that. I think I muted myself by mistake.
Okay.
Yeah, so we would like to expand to more states. I don't know if we'd love to be in all 50, but I think that would take a while. But what we're hoping is to start with states that are lower resourced. We started in Massachusetts because that's where we're from, and we found that Massachusetts has a lot of resources, a lot of organizations, a lot of resource directories, and so it's been a little hard just because there's so much happening here. In Louisiana, it was different because they have fewer resources there, so that in our minds was a sort of a better place to expand to, because they had less and they needed more. So I think that's that's what we'd start with, but we are, you know, we're really open to expanding to any state that, I mean, I think there's a need for this in all states, honestly. It's a big need. It's everywhere. But if, but we, you know, obviously we need support, we need funding. We're funded by, grants, and we are starting to work with the Department of Education in Louisiana. They funded us to enhance their educational guidance. We'd love to work with health departments and education departments, but right now we work with foundations and grants. So if we have support and interest in partners to work with, we would love to expand to new states.
You want me to continue the questions or?
Yeah.
Okay, so another one is, do you consider the confidentiality of the search? The topics and information can be sensitive, just as an inquiry, as the Internet captures anything and everything with cookies and sell to promotional outlets and partnerships.
Yeah. We are very careful about that. We recently changed our web platform to one that was more secure. Right now, unless someone puts their email into our, our chat box or our contact page, there's no way that people can be identified specifically by using our site. And then when we do get email addresses, we don't share those with anyone. We use them only to get back to a person to answer a question. But we are aware of that. We have our tech people, looking very carefully at the security of our site. But I think it helps that we don't ask people to put in any information unless they put in their email to get a question answered. I hope that answers the question.
And this was something someone shared. Missouri has a nonprofit called Impact, M-P-A-C-T, that provides patients with an advocate to help educate them about their rights and will attend IEP/504 meetings with them at school. And have said maybe your state has something similar.
Yes. No. I think most states have something similar than that. And what we try to do in Massachusetts and Louisiana is to partner with those organizations and try to complement each other. So, for example, in Louisiana, there are 10 centers around the state called Families Helping Families, and they will do that as well. They will advise families on different needs. They'll help them apply for things. They'll go to IEP and 504 meetings with them if needed. And so what we found is we've worked with them, and they help us to get focus groups, and they help us with making sure that we have the right information and are advising parents on the right things. But what we find is that organizations like that in most places are very strapped. There's a lot of need and there's few staff. They don't get much funding. And so a lot of places, people in organizations like that struggle to meet the demand of the parents that they're trying to help. And so what we found is that if they can if they get a call from a parent, the problem, they make an appointment with them, but in the meantime, they send them our flyer and they say, go on to Exceptional Lives, go through the special ed guide, before we meet, and that can answer sort of your basic questions about it, so that then when we do meet, we can use the time more efficiently to work with your particulars and your special situations. So we're hoping, and they do say that it does help them to expand the reach of how many families they can serve. So we try to work in concert with organizations like that. And I'll look this up because Missouri is one of the states that we've been talking to people about, and we think would be a good candidate for trying to make our resources available. I'll keep getting questions, just a few ways that librarians and and other people that work with families can use these tools. We just like I said about the family organizations, to lead people to our site as a starting point for finding the help they need is helpful. So when we talk to librarians and other service providers, we send them flyers, or they have bookmarks at the libraries. You can take our flyer. We're trying to work with pediatricians and nurse practitioners and clinics to sort of be able to hand our flyer out and circle sort of like a prescription here. This is the information you should look for. These are the kinds of things you can try to search for in the directory. Like I said before, people can sit down and do a search with a family and then print out the results for them. So yeah, social media, newsletters, things like that. So these are the ways that we hope that librarians, public health people, other advocacy groups can use our tools to work with families. Yeah, and Katie, I see your response, and yeah, that's fine. I didn't think that. These are just some numbers of what we have, and just some reactions from parents. I guess that's basically what we have. And like I said, I know I feel bad presenting this to like states that are outside of the ones that we have really created all of these tools. But I'm hoping that you can use this. You can use the SSI guide and read our blogs, and even if people are from out of Massachusetts or Louisiana, if you go through one of the guides and at least you have understanding, okay, this is written for Louisiana or Massachusetts, but most of the guides still walk you through a lot of the basic information and things you have to do. So for example, if you have a kid that you think might have autism, but you're not in one of our states, if you go through the autism guide, then it'll really help you to understand, okay, here are the issues, here's what it is, here are the people I need to get in touch with in my state. Here are the things I need to think about at home. So there's still some value, and like I said, we are trying to expand to other states. One of the things I sort of skipped through the slide. We also we also can get data on what people are looking for and what resources exist in certain areas. So, for example, so we can get all this data, like what are people really looking for, and that can sort of help policy sometimes, or help sort of states to realize, okay, these are the needs in my state, these are the areas where the needs are greatest. For example, we have we found in a certain neighborhood in Boston, there was a really high number of searches for applied behavior analysis, for ABA therapy. And in that zip code area, in that neighborhood, there were no ABA therapists. So that's something that we hope eventually we can bring to policymakers and say, there's a really high need for therapists. There's not enough to go around, and what can we do to incent therapists to get trained and work in these areas. So we try to use our data to sort of help with that kind of stuff too. Let's see, how is the data gathered? So we get the data from from our software. So for the resource directory, for example, it can collect who's searching for what from each zip code. So all of that is captured. And then on our website, we have Google tags and we do Google Analytics, and so we know which pages of each guide people are on most. One of the interesting things we found there is that when we go to focus groups and we say, what do you as parents need to know? What would you like to have us address? Almost nobody ever says self-care, how to take care of myself. But we always put that in there anyway in our guides. There's always a section on that, and we find that like we can tell how long people spend on each page. We can tell that people spend quite a bit of time on those pages. So it's interesting because they don't think of it, or they don't admit it, or they, it's not a top of their mind. But once they see it, they realize, oh, I do need to learn about self-care. So that's one of the ways that we can sort of use our data to sort of figure out what people need more of. Yeah, our time is almost over. I'd love it if people have any questions to please email me. You can also, just go to the info email on our site and say, I'm trying to reach Julie. We have a very small staff. But thank you for being here and for listening to this, and I do hope that it can give you some ideas of some needs that are out there and ideas of, some ways to sort of go through a process and present information that can really help families understand the processes that can help them. So again, is there any other questions?
Julie, could you just advance? I wanted to talk about Medline Plus for just a minute.
Yeah. So you want me to advance it? Yeah. Okay. Yeah.
Okay, or else you could just give me the ball back if you, either way.
Okay, I'll just do that.
I just wanted to finish up, folks, with also a resource that's available to all of you, and I know many of you probably do know about Medline Plus, but there have been some updates to Medline Plus, and one of the things, let me first say, so Medline Plus is the online health information resource for patients and their families and friends. It's a service of the National Library of Medicine and is a part of the National Institutes of Health. We have over 1,000 topics on disease, illnesses, and health conditions, and each health topic page links to information from NIH and other authoritative resources and sources, as well as a PubMed search. It uses Medline Plus uses a strict set of selection criteria to choose the quality resources to include on our health topic pages. And so there is a new Medline Plus About Us page that I think is if you haven't checked this out lately or don't know much about Medline Plus, I would really suggest that you look at this page. There's a very nice welcome from our new director, Patricia Brennan. And so if I would have done a topic search on disabilities, this is what the page would look like. And then you can see there's related health topics. And under related health topics was developmental disabilities, and this is what that page. So every page is developed and constructed the same way, where you get the summary, you have a start here, there's the medical encyclopedia that you can help, that helps you with definitions and things too. One of the other nice things about these health topic pages, there are particular things like for you, so the part just for children's specific audiences, and on this developmental disabilities page for you, there are some patient handouts. So if you have not checked out Medline Plus in a while, I would encourage you to look at Medline Plus. Look at the health topic pages. As I said, there's over 1,000 topics, and there's also one on healthcare systems. So again, navigating healthcare and some things like that. There's some helpful guides. Here is the reference page that Julie had put together, and I included our Medline Plus page on that. So here are our email addresses. If you have any questions for either of us, you can get a hold of us this way. And so again, I'd just like to thank Julie for her presentation today. There was a lot of information, so much of value, I think, to any of us. And as she said, even though that some of it is state-specific, there was still so much information that you can explore and look at. So thank you all. When I close, there'll be the link to the evaluation, and it is also in our chat box.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.